Hello and welcome to Kickback Science Podcast. I'm your host, Dr. Luke. This podcast is your place to get the tools and knowledge necessary to navigate the world of health and wellness. So kick back, let's talk science. This is good content. This stuff has gone crazy. We'll jump into it. Let's dive in. Let's do a little science. I'm going nitty-gritty science right now.
I've been looking forward to this.
Kind of going on a little bit of a tangent.
Oh, yeah, that's right. I forgot about that.
The information we discuss in this podcast is not meant to be taken as medical advice. It is simply informative. We're not affiliated with any organization or institution, just a few guys talking science and having fun. All right, what's going on, fellas?
Hey, Dr. Luke, how you doing, man?
Good.
I'm finally on a microphone, boys.
Yeah.
Welcome, Joe.
I don't know if we're going to regret giving this guy a mic, but
I won't stop talking.
it's already going. All right, so today we're going to talk a little bit about saunas, the benefits, risks, all that, I assume. So, Reed, start us off. What do you got for us?
Well, I was diving in a little bit deeper into saunas, and it's just been a craze. It's always on my social media. It's popping up, like buying saunas at home, and I've just been so curious, like, what are the benefits to doing saunas? Should this be something we do every single day? Why is there a big craze about it right now?
Yeah, well, I mean, I don't even know that it's just the craze right now, because sauna use has been utilized, all throughout history. Became super popular in Finland, so there's like a Finnish dry sauna that's like rooted into these Finnish traditions. And even in like the indigenous people in the United States, like Native Americans had these sweat lodges that were a place of, all these different types of ceremonies and things. And you can imagine, I mean, if something like that has stuck around for so long, there's probably some positive benefit that people are realizing from this. So it's been studied pretty heavily using observational studies. So observational studies are where you're essentially just taking a group of people that participate in some intervention. Here, we're talking about saunas. And you're going to compare different health outcomes of those people based on if they sauna or not, or how frequently they sauna and how long they're saunaing. And then you'll follow them over time and see, okay, are the people who are sauna or in the sauna for less amount of time, are they getting more instances of certain chronic diseases versus the people who are in the saunas for longer and more frequent? And as it turns out, that's really what the case is. There's this lab in Finland, of course, that seems to be putting out way more research than anyone else on this. And you can imagine why. I mean, saunas are really popular in Finland, and they've got a large population of people that they can study here. And so in one particular paper that came out in 2015, they had over 2,000, this was just done in men, but over 2,000 men, and they basically looked at how frequently are they in the sauna per week and divided them into three groups. So 1 time per week, 2 to 3 times per week, or 4 to 7 times per week. And then they just followed them for 20 years and looked at, okay, what's happening with all these dudes? And as it turns out, the people who are saunaing more frequently had a lower risk of cardiovascular disease. This one was really heavy into like what happens to your cardiovascular system, because that's what seems to provide the most benefit from sauna, is the impact that it has on your cardiovascular health. Turns out that these guys who were in the sauna more frequently had a 63% reduction in cardiac death, a 48% decrease in coronary heart disease, and a 50% decrease in cardiovascular disease overall relative to people who are sauning once per day. And again, this isn't comparing to someone who's not sauning at all. So this is 1 times per week compared to the group that's going 4 to 7 times per week. And so just from going 1 to 4, it seems like you get this huge increase in cardiovascular function. So that's where this stuff got really popular, was like, oh, the cardiovascular health is huge. But the problem is this study was only done in males. And so they did a follow-up study in 2018 where they found the exact same thing in females. So, I mean, whether you're male or female, this is going to have the same impact. So I mean, and we'll probably talk more benefits as we go through the podcast here, but that's what has kind of sparked this attention is, okay, cardiovascular disease being the greatest contributor of death globally. And now we've got this tool that can reduce the incidence of cardiovascular disease and any of these cardiac complications. Let's look further into it. And again, these are just observational studies as opposed to like a randomized controlled trial where you're like, hey, you guys go hop in this sauna 3 to 4 times per week, and then you don't do a sauna, and we'll divide you into those 2 different groups. Then you've got a control group, and then you can better assess the population when the study starts so that you can see, okay, are the activity levels similar between the 2 groups? Smoking, disease risk, age, medications, and you can kind of control for all these what we call confounding variables, so other things that might influence the outcomes. They did do that in these studies, so they stratified. After the study was done, they went and looked back and saw, okay, if we kind of screen for smoking activity and all these things, do these outcomes still hold true? And it turns out they do. So yeah, pretty cool area of research for sure.
How does heat, like saunas, change like your cardiovascular health? Like you're just sitting there in heat, like you think of doing cardio will improve that. Like how is just sitting there in heat? Or like what if you did cardio and sauna? Would that be double the benefit? Or like what's the science behind that?
Yeah, what's interesting, and I mean, there's going to be a variety of theories here as far as like how can just getting in a hot temperatured environment have an influence on your cardiovascular system. And it's multifold, the effects, but I think of it, and this is similar to like when we were talking about cold exposure in another podcast. I think of it as a similar group of effects as exercise. So when you get into a hot environment, your body senses that. So you have these nerve receptors on the periphery of your skin, and they're able to sense temperature, heat and cold, and communicate that to an area of your hypothalamus called the preoptic area. And that's what regulates your body's internal temperature. Your body wants to stay at this 98.6 Fahrenheit. And if it deviates from that temperature, certain enzymes in your body start to not function properly, and proteins can even misfold and become damaged. And so it's really important for your body to try to keep this consistent temperature. Now, when you hop into the sauna, your core body temperature increases. And so that's pretty stressful on your body, you can imagine. And so when this area of the hypothalamus senses, whoa, we are in a hot environment all of a sudden, what it's going to do is it's going to constrict the blood vessels to your skin. It's going to do the opposite. That's what it's called. It's going to dilate the blood vessels to your skin, and try to lose heat as energy by sweating. And it's also going to increase what's called cardiac output. So your heart's going to be pumping more blood to try to get rid of some of that excess heat. Systolic blood pressure is going to increase right around 15 milligrams mercury. And these impacts are basically a stress response on your cardiovascular system, but it's temporary. And it's similar to when you start exercising. So if you start exercising, I had you hop on a treadmill while someone's in the sauna, and we looked at, okay, what's happening to your cardiac output, your heart rate, your sweat rate, and all these aspects, it'd be pretty comparable. Your blood pressure is going to go up. And the thing is, once you're done then, all those numbers will return back to baseline. And over time, your body's going to become more efficient at handling that level of stress. And there's this idea called hormesis, where certain stresses cause your body to adapt and become more well-equipped. And over time, it's kind of important to have these little stress responses to help your cardiovascular system in this instance respond. Does that answer your question?
Yeah, it does. Yeah. And then when I was a trainer back in the day, we'd always, trainers, I'd hear him say like, hey, go in the sauna if you have time. It's going to release those toxins that you didn't get out while working out. I never really understood that or knew what toxins they were referring to. Do you happen to know more about that and like what those toxins are? Like, is that beneficial or is that something made up? I don't know. I didn't really believe it. I was like, all right.
So I think of this like detox as a buzzword that's thrown around to try to like establish some level of credibility. You hear the same thing when people say inflammation. And we do throw that word around a little bit, but when you hear like, reduces inflammation and things like, you want to ask like, okay, like on what aspect? Like inflammation is such a broad process that happens in your body, and like a little bit of inflammation is beneficial, just like that hormesis process I was talking about. When you exercise, you increase inflammatory markers, and so this detox kind of has that same feel to it. Now there is this idea of detoxifying to try to release some levels of metals circulating around your body, so mercury and lead, and because when you sweat you are excreting like very small levels of mercury and lead in your sweat. But if that actually like has an impact on your body's levels of those metals is totally not evident. Like we definitely don't have any data to support that. So the idea, I guess, makes sense. And I imagine that's what people are referring to
I'm
with
hoping,
this
yeah.
detox. But I mean, like, so let's say like you hear people like, oh yeah, I was drinking, I'm going to go into the sauna when I'm hungover because I want to just detoxify and get rid of all that alcohol. Alcohol isn't just going to come out in your sweat. You're not, your body needs to metabolize.
Sometimes it does smell like a bar in the
Yeah.
gym on
Yeah.
a Sunday
And that's
morning.
probably people like, as you exhale, you can still smell alcohol on people's breath, even as their body's metabolizing it. But no, you're not excreting that in your sweat.
And let's talk about some of the risk factors, because we talked about some of the benefits like cardiovascular, but what are some of the risk factors and like who should stay away from doing heat therapy?
Yeah.
What's your opinion on that?
Well, it's not recommended for anyone who has an issue with what we call thermoregulation. So I brought up this area of the hypothalamus that regulates your body's temperature. As we age, we become a little less efficient at controlling our internal temperature. So as you get older, you're not going to be as comfortable in the cold or in the heat either, because your body's just not as efficient at this. And so when you're older, if you have thermoregulatory issues, you probably don't want to go into the sauna for very long, because you don't want to get hyperthermia. You don't want to overheat. And people,
what would be an optimal time in the sauna? Sorry for jumping in right there. But
well, let's save that for a second.
Okay.
I'll finish with the risks, and then we can get into like protocols and stuff after we touch on some other aspects of it. But and I mean, for optimum time, it's going to differ, and we'll talk about how it will differ. But people that can't thermoregulate very well, and then also people that have cardiovascular issues already. So I mentioned you've got this increase in cardiac output. So how much blood is your heart pumping? How much work is your heart going through? And to kind of backlash on like cardiac output, I throw that term around, but essentially what it's doing is every time your heart beats, it's pumping out blood. That's called your stroke volume. And the rate at which that happens is your heart rate. So the rate at which your heart pumps per minute is your heart rate and beats per minute. Cardiac output is how often is your heart beating? So what's your heart rate? And multiply that by what's that stroke volume. So each heartbeat, how much blood are you pumping out? People with cardiac issues tend to have an impairment in that stroke volume. So they don't have the ability to pump that blood to the rest of their body very efficiently, and you'll see their resting heart rates tend to be a little bit higher because they're less efficient at pumping blood, but they still want to meet this cardiac output. Your body needs a certain amount of blood circulating, and so if stroke volume drops, heart rate's got to go up. We can save that for another cardiovascular lecture per se, but people that have cardiac issues may not be able to tolerate the increased workload of the heart. And then also, if you have, additional cardiac issues that involve hypertension, you've got an increase in blood pressure. How well can your body handle that increase in blood pressure? So it's more risky for people that have angina. So any chest pain, heart failure, previous heart attacks, and things like that. In addition to the thermoregulatory issues, there's also a risk associated with people that are pregnant. And because when you do increase your core body temperature in the sauna, which I mentioned, I mean, it does go up quite a bit. That does also increase that environment of this growing fetus when you're pregnant, and can have an impact on that as well. So it's not recommended for pregnancy. And then also while you're nursing. So after pregnancy, your body actually has to sustain a slightly different internal temperature, and you don't want to mess with that temperature. And so that's the populations that tend to be more at risk. But as far as like when you're in the sauna, what are the risks that could happen? Dehydration's huge. I mean, you're losing fluids, and then just feeling dizzy, getting headaches from the dehydration, and then overheating. Those are the big ones.
And then I did stumble across an article about low sperm count in males. Do you have any more information on that? Is that true, or is that just kind of...
Yeah, and I imagine we came across the same paper. Actually, it was you that recommended it to me.
That was me.
That I take a peek. Yeah. So when you look at that paper, I mean, this definitely isn't an area of a ton of evidence, but they did take groups of healthy males and had them go through 3 months sauna protocol a few times per week, and then they measured their different sex hormones, so FSH, LH, and testosterone, and these are what regulates spermatogenesis, so the production of sperm in your testes. And they found that there wasn't a change in these sex hormones, but there was a change in the quantity and function of the sperm that these males did produce. But those did return back to baseline levels after discontinuing the sauna protocol. Now, this is just one study, and I want to highlight that, because when you see an outcome like this in one study, it's very popular to blow that up. It's something that people try to change the title of, like, oh, don't sauna, you're going to be infertile. And that's not what the evidence shows. There was that one particular paper, but I don't think, based on what we know, that there is really a risk.
Not enough evidence. Yeah, absolutely. Sorry, I just keep cutting in each time.
No, you're good.
I don't want to just keep stealing.
No, that's okay.
I'm going to circle back. So Luke, let's circle back on the optimum time spent in a sauna. And also, when I was a trainer, sometimes I would see people, they would sauna before their workout to like warm up their muscles, go work out, and they'd also sauna afterwards. I've also seen where people, they would do sauna for 10 minutes or so, go do cardio, come back, and they would do that 2 to 3 times. Are they just wasting their time there? What's the optimal way to use a sauna?
So it's going to be different for everybody. And as far as like exercise training specifically, so we can talk about like what is the reason that people tend to pair sauna with exercise. And it's because there's a few studies that showed that people sauning after their exercise session had an improvement in their ability to train. So in endurance athletes, this is especially true. There's one study with male endurance athletes that when they did 30 minutes of sauna after training, they found a 32% increase in time to exhaustion. So like essentially like a time trial of how long can you tolerate this level of physical activity, whether it's a bike, treadmill, etc. So it does have an impact likely on that recovery aspect and ability to perform. So it increases performance. And there was another study that showed after training, saunaing decreased muscle soreness and preserved muscle function as well. So this is there is a group of literature consistent with that in terms of like, oh, if you sauna after your workout, you have this enhanced performance aspect similar to that cold exposure idea of recovery. But here you're actually improving the muscle's ability to go through that protein synthesis and build. So it's not going to have that detriment of muscle growth that cold exposure has. So you're actually going to enhance the process of growing muscle and enhance the strength gains that you get. Now, there is a study showing the risks of combining sauna before exercise. And actually there's a couple papers like this where if you did a sauna prior to your exercise session, it resulted in an impairment in your ability to go through whatever training protocol you're going through. And so, I definitely wouldn't recommend doing it beforehand, but if you're going to implement it for the strength and adaptations of training, you want to do it afterwards for sure.
Oh, wow. Because, yeah, like usually you think of like warming up your muscles, starting that out. So you'd think that'd be the same thing as doing like a warm up on the treadmill or something for 10 minutes, 8 to 12 minutes. But that's interesting. I didn't know.
Yeah. I mean, and it turns out it doesn't work that way, that you definitely want to incorporate it afterwards. Now, in order to talk about like duration and the protocol itself, we want to touch on a couple other effects that sauna has other than just cardiovascular health, because there's this area of research in cognitive health, so mental health aspects of it, and then the effects that it has on sleep and pain. And if you're trying to garner these benefits utilizing sauna, you're going to want to incorporate it a little bit differently. So for sleep, for example, when you go to sleep, your body has to actually drop a couple degrees in order for you to fall asleep and stay asleep. And so this is where that thermoregulation comes into play and is super important. And if you have an impaired ability to thermoregulate, then that's going to impact your ability to fall asleep. And there's a really cool study that explored this idea of if you were to get really hot taking a bath prior to exercise. So they did this in a group of women where they had them take a bath it was 104 degrees. That's pretty hot. 90 minutes before going to bed. And that increased their ability to fall asleep. It improved sleep. And the reason is if you heat your body up, your body's forced now to go into this active cooling process. So it's going to just ramp up the process of cooling you down. If you do that, far enough out from sleep, you don't want to like get super hot and then just lay down in bed, because then you're obviously not going to fall asleep. But if you can really ramp up that cooling process, it helps with sleep. So if that's the goal for you, you're going to want to shift your sauna time closer to going to bed if you're trying to get the sleep aspects. The mental health and cognitive function portion of it, there's a group of papers that actually that group in Finland put out a paper of the similar thing where they're assessing frequency of sauna use, and people that sauna 4 to 7 times per week had a 66% reduction in dementia compared to people that went once per week, and then a 65% reduction in Alzheimer's incidence. And if you're going to sauna for the sake of trying to enhance cognitive function, there's probably not a specific time of day that's going to be better versus the other. But what I would say is, so poor sleep is a risk factor for dementia and Alzheimer's. And so if you're really trying to get those aspects, it might be smart to shift it towards, trying to get the sleep benefits as well, because then you're getting 2 birds stoned at once there. And so there's another aspect of like pain, and there's a meta-analysis that came out that just looked at, when you're doing these heated environments, what's happening to like back pain, because a lot of people will go in there and feel a little bit more relaxed. It's a little bit more conflicting, the evidence is here, but overall there is a trend towards if you're in the sauna more frequently, your incidence of chronic pain is going down. And so if that's the case, I mean, then it really doesn't matter when you sauna.
And then talking about weight loss, is sauna good for weight loss? You'll lose water weight, obviously, because you're going to be sweating it out. But is there any other evidence that shows that this improves your weight loss, or does it just do nothing for that?
So as far as like the water weight you lose, if you're going to rely on that as a weight loss tool, then you're kind of just requiring yourself to stay in this level of dehydration, because whatever you lose through sweat, you do want to replenish. It's really important for your body to sustain these fluid levels, and your body's going to do everything it can to get back to its baseline fluid level. And in fact, there's this cool area of research on plasma volume and what happens after you sauna. And when you're sweating, you're losing plasma. And so that's the portion of your blood that we're not talking like red blood cells, white blood cells. We're talking the plasma portion that is highly contains water. And when that goes down, your hematocrit changes. So hematocrit is the percentage of red blood cells that are circulating around in your blood. So it's not just red blood cells. Red blood cells make up right around half of the circulating blood. The rest is going to be white blood cells, proteins, and that plasma. And so when you lose that plasma and you have an increased percentage of these red blood cells, your blood becomes a lot thicker, a lot stickier. It's harder for your body to pump throughout. And so your body's going to then, it's going to be able to sense this and try to retain as much water as it can to restore those plasma volumes. So they did studies looking at after you sauna, we know that plasma volume's going down, but is your body able to restore that plasma effectively? Turns out, not only is it able to return back to baseline, which if you're healthy, that shouldn't surprise you, but it actually enhanced plasma volume. So these increases in white blood cells and plasma volume after exercise, which is great. Your body is increasing blood volume, which we see with exercise. And so, if you're trying to rely on it for weight loss to lose this water weight, then you would just have to stay in this chronically dehydrated state, and then your hematocrit would increase, your cardiovascular system would be impaired. So, sure, I mean, you could sweat out all this weight, but it is absolutely not going to be healthy. Now, area...
Well, real quick, so you're saying it doesn't burn fat at all?
No, that's not, and that's actually what I was just about to say, too. The area that would be interesting in terms of weight loss and the effects that it would have is how it influences all these other aspects of your health. So if you're doing this stress activity like sauna or like exercise, you've got this increase in cardiac output. You've got these cardiovascular adaptations. You're sleeping better. Over time, your overall health is going to improve. And that's going to be a huge contributor on how metabolically healthy you are. And so I would hypothesize to say, if you sauna more frequently and have an improvement in these aspects of your health, I don't want to say you'll lose weight, because I think that that's not the goal that people should have, but you will be more metabolically healthy. So yeah, I mean, it would make sense that way.
It's kind of just ramping up everything, being able to have that endurance and pushing yourself a little further to be able to help that metabolic rate.
Yeah, well, I mean, you're essentially forcing your body to adapt to that level of stress. So exactly that. If you were to go through that level of stress again, your body's more equipped to handle it. I wouldn't it would be interesting to see. I brought up this hypothetical study design. We should do this, where it's you go in the sauna for this amount of time, and then you go on a treadmill that elicits a similar cardiac output, heart rate, and blood pressure. And then we just compare, what's happening metabolically, what's happening physiologically within your body, and see the differences. Because I imagine there's some level of similarity. Because I mean, and there's one area that we didn't talk a ton about, which is the effects that sauna has on norepinephrines and growth hormone and heat shock proteins and all these other like circulating hormones and catecholamines like exercise that likely give you that like feel good satisfaction after your sauna in the sauna, similar to after you're done with a workout. And so there's this group of endorphins. They're called beta endorphins, and they bind to these opioid receptors in your brain and give you this sense of, feel good and
a dopamine response, basically, or
similar to a dopamine response. But these endorphins bind to a separate group of receptors that kind of act as like a painkiller for your body, and then also like an increased sense of well-being and decreased stress. And it would act similarly to an increase in dopamine. But what also happens is you get this other group of these catecholamines, hormones, that are called dynorphins. And dynorphins bind to this separate opioid receptor called the kappa opioid receptor. And they block the effects of the endorphins. So they block the, that feel-good painkiller sense. Turns out that happens in these stress responses too. So when you're in the sauna, you have this increase in dynorphins kind of impacting those beta endorphins. So people are thinking, oh, this is, potentially blocking that effect. But as it turns out, if you have these elevations in dynorphins continuously, what happens is your body will increase the amount of these mu opioid receptors that the endorphins bind to. And so next time you have this endorphin release, you're better able to respond to that. Essentially, you get more sensitive to endorphin release. So it definitely doesn't have that negative effect. In fact, it's positive when these dynorphins release. And there's an increase in heat shock proteins, and this happens when you exercise too. These heat shock proteins, what they are, they're referred to as chaperone proteins, because they're essentially hanging out and just making sure all proteins within your body are not misfolded, degraded, and that they're able to properly function in the way that they're intended to. And so having an increase in heat shock proteins just makes this process of protein synthesis, muscle building, recovery, makes that process much more enhanced and efficient. And so you see that with sauna use as well.
Just nailed everything on the head, man.
We can talk a little bit more about protocol, because you talked about timing of day,
duration. I know it's different for everybody, but
yeah.
So how long should people be in the sauna for? Should you start out less time as a beginner and then it just progresses, obviously, like when you're training, or like what's the duration that you'd recommend?
Yeah, that's like you said, that is gonna depend on how experienced you are in a hot environment. Like literally, just like here, we're in Minnesota, we don't have the heat adaptation that somebody who's in a constantly hot environment does. And so heat exposure is going to be a little harder for our body to adapt to, or not harder to adapt, but it's going to provide a greater stress stimulus. So we're going to require less time. Most of the papers using dry sauna show about 15 to 30 minutes has that impact. I wouldn't start right away with 30 minutes. Try to start with 15, see if you can work your way up. And you can do these in increments. So you mentioned like going in, coming back out, going back in. You can absolutely do that route too, because
and they'll give you the same benefit as just doing one big long run, just kind of cooling off and then going back in. I see people do that all the time.
Yeah. And it's because it's difficult to sustain 30 minutes in a sauna. Because another thing I should mention too is most of these papers using dry sauna have showed the impact on temperature ranges from 176 to 212 degrees Fahrenheit, and that's 80 to 100 degrees Celsius. Now that's pretty warm. It's pretty darn hot. And the sauna that I go to, for example, when I was looking into the research on most of this stuff, I just checked, and it was right around 160 degrees. And it's like, oh man, this needs to be a little hotter, because you want to try to be at least that 176 in some dry saunas that I've had experience. Now I'm going to check the thermostat every time I go in there because I'm curious. But like this particular one that I use is like got to try to figure out how to heat it up. But the temperature is going to change the amount of time that you spend. And I should mention too, when we're talking about these benefits, I'm not just talking about dry sauna. The papers that we've discussed go through a variety of different protocols. This group in Finland focuses on those dry saunas, but some of the other papers use the steam room exposure and then even tubs that get warm. And even just standing outside on a hot day is going to have similar effects on your body. You're going to go into that trying to cool yourself off, increasing cardiac output, yada, yada, yada. But what is important is if you're going into a steam room, your body does not have the ability to release energy through sweat as efficiently. And so if you're in a steam room, you're actually going to overheat much quicker, and you don't enhance this process of thermal regulation through heat release with sweat.
I have noticed that in the steam room. It's like right away it hits you right in the face, and you can't be in there longer than like 10 minutes.
Right.
But you were saying also the tub. So would that include like a hot tub? Does a hot tub have the same effects as a steam room and a sauna?
Yeah, so there's not like these comparative studies that are randomized of like you go in this sauna, steam room, hot tub, but there are studies on the utilization of hot tubs in a similar fashion. But hot tubs similar to steam room where you don't have that ability to release energy through sweat when you've got that water and the steam impacting your body's ability to do that. Yeah. So the adaptations that you're going to get, thermal regulatory, that influence all these processes of helping your body cool down and such. It seems to be that dry sauna is probably going to have the greatest impact, the greatest benefit there. And so when you go into a steam room, you probably want to spend a little bit less time. And then there's also like infrared saunas. Infrared saunas use this wavelength of light that your body is taking in as heat. These tend to be a little bit cooler in there. It's hard to get those saunas as warm, so you'd want to check and see what the temperature if you're using an infrared sauna. But the numbers in there may increase slightly, and also like manufacturers of these infrared saunas are going to be utilizing slightly different wavelengths, so it's going to be different. Whereas like the dry sauna, you've just got the temperature that you're focused on. So it's a little bit easier to kind of come up with your own personal protocol, but check, see, are you right around this 176 degree Fahrenheit, 80 degrees Celsius in the sauna, and see how long you can tolerate that, if it's 15 minutes and work your way up to 30. And then as far as like how often should you do this? We talked about like where should you structure sauna, like how should you utilize it throughout your day, after exercise if you want to get the benefits for recovery and training, closer to bedtime if you want to get the benefits for sleep, but how often should you be doing that? If you're training 5 days a week, should you just do it on those 5 days? Should you increase it? And that's what's interesting is there's what's called a dose response to getting in the sauna. So that Finnish group that assessed people that went 1 time to 2 to 3 times and 4 to 7 times, all the benefits they're showing increase the more frequent you sauna. And so if you can do, it looks like at least 4 times per week, you want to try to do this 15 to 30 minute protocol. And if you can stretch that out to 7, because it sure shows that, the increased frequency here is going to provide you with the greatest level of benefit.
So in your opinion, sauna?
Yeah. Yeah. I mean,
right.
and I like,
I never do. So
it's great.
I'm going to check it out.
Yeah. And especially like, cause I've messed around with the sleep aspect of it too. So my PhD dissertation was entirely studying like sleep physiology, and then after like learning the thermal regulatory impact, I started doing like, okay, let's try out this hot shower, and then started sauning closer to bed. And you notice that right away. It's pretty incredible. As far as like the recovery stuff goes, I didn't notice significance in my training, as far as like, was I getting stronger because I was training in a correct way, or was it because of the sauna? I couldn't really ration that out, but I did also get that, like, stress relief that sauna provides. Like you tend to just, like, in a warmer environment.
It's relaxing.
Yeah.
Relaxation, breath.
Yeah.
Work.
It's definitely, like, it's hard to sit in there for a long amount of time, and you get adapted. Like, it's been, I took a period of time where I wasn't going in the sauna, and then actually recently started back up, and the amount of time that I could tolerate dropped so much. It's crazy how your body just gets so efficient at thermoregulating. And when I say I would recommend this, it is always important, if you're unsure about your thermoregulation, cardiovascular risk, and overall health, that you consult a physician to bring this stuff up. I don't want to tell people go hop in a sauna if you don't know if you're able to tolerate it or not, but it seems to be safe for most people.
How long, when you first started, how long did it take you to get to that 15, 30-minute mark? Was it pretty quick?
Yeah. So when I started getting really into this, it was actually based on the group of papers that came out of Finland and showing this. I tried to do 30 minutes. That was my initial goal, was 30 minutes after every workout. It's hard for me to do 30 minutes, one, because of, like, just time in general. This is while I was doing my PhD that I was doing the sauna. And I found that if I was able to, like, use the sauna for productivity, it helped. And once I started doing that, then I could increase it to 30 minutes. So if I'm, like, listening to some sort of educational content for class or whatever it might be, or reading research articles and such, it was such a great setting for that. And so then I worked up pretty quick. I started with 10 minutes, and then it was, just a matter of weeks before I was feeling comfortable there. It was pretty fast.
So what's the minimum time that you start seeing the benefits?
So based on these papers, 15 minutes.
You nailed every question I had, man. Great job.
Yeah, this is unlike cold exposure, this sauna just doesn't really seem to have any of these, like, physiological issues that may result. Like, it just seems to be so beneficial for
I kind of look at it as, like, when you're cooking food and you throw it in an ice bath, it stops the cooking.
Yeah.
Kind of same thing with cold water immersion. It stops your muscle growth.
Oh, interesting.
And then if you go in the heat, you're expanding those muscles to, I don't know, that one. Yeah.
Chef Joe back here.
Chef
He's
Joe.
relating it back to food. that is actually kind of like a decent analogy of, like.
I thought it was super interesting that, like, doing it beforehand, I thought, like, it would just warm up your muscles. That'd be beneficial, but that actually has no benefit. Like,
Yeah.
I had
And in
no
fact,
idea.
it's
I've
actually
seen people do it all the time.
right. And it's actually shown to have a negative effect on exercise.
That's crazy. That blows my mind.
That was kind of interesting. I mean, I was in the gym the other day. Guy went right. He got there, got ready to go to the gym, went straight to the sauna. I'm like,
Yeah.
Now it's hey, don't do that.
yeah, don't do that.
Hey,
Just
don't
do it after.
You guys should
Check
try
out
that.
this podcast. I know they talk about it.
It's pretty sweet.
yeah. Big plug for the podcast.
Yeah.
You guys should try that, though, the sauna before your workout sometime. And because I have done that, and you do. I mean, me personally, and maybe it's just the placebo. Like, I know that this has a detriment to my
sweaty
training.
Is that so? There's talk about, like, would it be similar to, like, the talk of, like, doing cardio before you lift versus after? Is that kind of the same effect you're getting? Because they say if you do cardio beforehand, like, you're going to be a little less likely to be able to lift more weight, sustain that heavy weight.
Yeah, I imagine that's where people came from with the idea of sauning before exercise, and the impact that it has was actually probably the opposite. Because you hear a lot of people say, like, oh, you got, like Reed said, you got to get on the treadmill, warm up your muscles, and then go into the workout, recruit muscles. And we should do a podcast or a video short, and I'll summarize concurrent training, so cardio and resistance training. What does that do to muscle adaptations, cardiovascular adaptations, and how should you structure it before or after the exercise session? Because that's an interesting area.
I'd be really interested in learning about that.
Yeah, we'll talk about how it's.
Guys, this hasn't been recording this whole time.
Oh, man.
Oh, bro.
That would be freaking hilarious.
God.
That's all right. I could do that talk again. Yeah. So, I mean, did that answer most of your guys' questions that you came with?
Definitely.
Nailed every on the head, man.
All
I
right.
think I'm going to attempt 15 minutes in the sauna later this week.
Do it as
Maybe
often as you can.
After
7
when
times.
we go skiing, perfect time to try it out.
Yes. Yeah.
That's like the best time to try it out.
Yeah. To help with recovery,
Yeah.
especially. I mean, it's definitely something you want to add to your tool bag of health interventions. But sweet. All right. Well,
Thanks
let's go
everybody
sauna.
for listening. Yeah.
Thanks again for tuning in to the Kickback Science Podcast. We love talking science with all of you, and if you feel the same, you can support us by subscribing, hitting that like button, and giving us a follow on our social media pages. Don't forget, you can submit questions through our website and in the comments section of all our social media. Have a good one, everyone.